We got a special guest who is with us here this morning. We have Cindy Williams, who is a pharmacist with Riverside Health. There's been a lot in the news when it comes to vaccines and looking at guidance, et cetera, from the federal level and the impact that can have just for everyday people. So it's good to have a conversation just about vaccines and what we need to know. Cindy, thank you so much for being here.
Happy to do it.
So first question, I want to ask you this. There's kind of been a lot of apprehension from people who've expressed when it comes to vaccines. If people are on the fence about getting them, how do they start a conversation with their doctor about which vaccines would be right for them?
Right. So I think, first of all, it doesn't have to just be a doctor, right? It can also be another healthcare professional. So if, I worry sometimes if we narrow it just to physicians, there may be an access issue. So if you've got a trusted pharmacist, if you've got a trusted nurse, I think any healthcare professional that you feel that you've got that trusted relationship with, you can have that conversation. But back to your question, I think, the important thing is to really talk with that healthcare provider, understand what are the most up-to-date guidelines and recommendations, because those really are based in science. And I'll talk in a little bit about some of the changes for this year, specifically around COVID. But I think, your healthcare provider is up to date on what those recommendations are. Your healthcare provider knows more about your personal health history than anyone besides yourself. And so they really can be that trusted resource to guide you around the risk and benefits around each of the vaccines, specifically for the upcoming respiratory season.
And I imagine that's why it's so important to have those conversations with your physician, with your doctor and that expert. You mentioned kind of some of the changes that are kind of taking place from your expertise. Can you list some of those out for people that they need to be aware of?
Sure. So the changes for this upcoming season are really around the COVID vaccine. I think all of us are aware, we've had very broad recommendations around COVID vaccine since it was introduced in December of 2020. The current administration and the current leadership within the CDC has taken a step back to say we really want to focus on those that are going to get the most benefit from the vaccine. And so when you look at populations that are at highest risk for severe consequences if they do get COVID, we're really talking about older adults, so those age 65 and older, especially if they live in some type of co-housing environment like a long-term care facility, assisted living, whatnot. The second group at highest risk is going to be those that are immunocompromised. So those that are age 6 months to 64 that may have a health condition that puts them at higher risk for complications. So things such as respiratory diseases, such as asthma and COPD. They may be a cancer patient receiving suppressive therapy for cancer. So there are certain health conditions that put you at a higher risk for really any of the respiratory season type infections. And then recently, the advisory committee to the CDC has approved for anybody outside of those groups that would like to get a vaccine. They don't want to be a barrier for those individuals that may, because of their personal circumstances, still desire to get a vaccine, even if they don't have a high-risk condition. And so what has been approved at the federal level and has also been approved at the state level is individuals between age 6 months to 64 years old that don't have a high-risk condition but desire to get a vaccine should have a conversation about the benefit of the vaccine to them. But there could be circumstances such as you live with someone who is elderly, you live with someone who has another health condition, you work in a high-risk situation such as, direct patient care provider and healthcare. And so those individuals are eligible for the vaccine, but the CDC is recommending that they do have that conversation with their trusted healthcare provider.
What about the risk that could be associated with vaccines? I think people have that question there. Are there any, and which ones should people be aware of, if so?
Yeah. So, I think with any medication, right, there's not a medication on the market that there isn't some type of risk. With vaccines specifically, and I'll really maybe focus on the COVID vaccine, because I think that's where a lot of the changes in the discussion has been, recently. So we know that there are local vaccine reactions like you could have with any vaccine. You could get, a slight fever, you could get chills, you could get some soreness in the arm, and honestly, that just says that your immune system is responding to the vaccine that's been administered. So those are very anticipated type of reactions. And, those are common with pretty much any vaccine on the market. Another reaction that's very common with other vaccines on the market is a very rare syndrome, neurological syndrome called Guillain-Barré syndrome. That is common with all vaccines, so it's really no different with COVID than any others, and it is very rare. I think the one thing that has been shown with COVID vaccine in a smaller group of individuals is an increased risk of myocarditis, which is an inflammation of the heart. That is actually also a risk of getting active COVID disease. So that's common whether you get COVID and you get your immunity from COVID or whether you get the vaccine. The one small group of individuals where there has been shown to be a slightly higher risk than just COVID itself is males age 18 to 24. And so that group should specifically be aware that they could be at a slightly higher risk of developing some minor heart inflammation than the general population.
What about people with certain conditions? I know you were mentioning a few earlier. Are there any particular groups that need to take a little bit more precaution when it comes to taking vaccinations?
I mean, one of the things I didn't mention is obviously if you have an allergy to any of the components of any drug, right? That's
fair.
Sort of that's sort of the baseline, right? You shouldn't get something that you're allergic to. But it's really not a specific risk related to individuals. I mean, if you've had Guillain-Barré before, you would want to let your healthcare provider know that, so you wouldn't want to exacerbate that. But there's really no other specific risk with COVID vaccines if you have a high-risk condition. But what I would say is if you have a high-risk condition and that condition is because you're getting an immunosuppressive medication. So if you're getting some type of chronic medication, whether it's chemotherapy, whether it's something for Crohn's disease, for rheumatoid arthritis, the timing of that vaccine can be important in conjunction with your medication, because you want to get the biggest effect out of that vaccine. And so timing with your other medications that are immunosuppressing can be critical, and that's where having that conversation with your healthcare provider is very important.
How do I know I'm having an adverse reaction to a vaccine?
Yeah, so typically the adverse reactions we see, I really bucket them into sort of the immediate reaction and then those that you're probably going to see over the first 24 to 48 hours. The immediate things we look for with any type of medication reaction, if within, say, the first 30 to 60 minutes would be if you're feeling flush, if you're feeling short of breath, those types of things. Those are typically related more to an anaphylaxis type reaction, which is rare but is very serious. Again, that would be more you've got an allergy to a component of the medication. And those typically will have pretty rapid onset, usually 30 to 60 minutes. You're going to know there's something going on. Then if you look at that first 24 to 48 hours, that's more of that reaction, the vaccine's working. So that's when you're talking about you may feel a little, feverish. You may feel a little flu-like. You may feel a little lethargic. What I often, recommend, and you may have, pain in your arm, a little bit of soreness in the arm. What I typically recommend to folks is hydrate well. That will help with some of those symptoms. But also if you're concerned about having some slight flu-like symptoms, and again, that's just not the COVID vaccine, it's the flu vaccine, it's the shingles vaccine. If you're concerned about those types of side effects, then be deliberate about how you schedule your vaccine. If you work full-time, schedule that vaccine for a Friday. So if you're feeling a little bit like I tell my husband, we're going to get our vaccines on a Friday, and then we can lay around and watch college football all day on Saturday.
I know that's right.
So we will be very deliberate. We haven't typically felt bad after a vaccine, but why take the chance? I don't want to get it the day before I'm doing something really important. Do it, on a Friday when you've got the weekend, you can recuperate.
You mentioned, that's actually great advice, by the way. Anything that deals with just staying at home and watching college football, I am on board for that fully. But some of the risk of skipping vaccinations, are there any risks if you don't take them?
Yeah, so there's no specific risk as far as if you miss 1 year and don't have the next, other than you're putting yourself at higher risk for getting, getting sick from from the disease, whether it's flu or influenza, or flu or COVID. I think what everybody needs to understand is with flu vaccines and COVID vaccines, unlike some of the childhood immunizations like measles that actually fully prevent the disease, with flu and COVID, you're really looking at a moving target with those each year because the disease modifies itself. You've got a different strain year over year. And so the goal of those vaccines, the goal of the flu vaccine has never been to fully avoid flu. It's been to minimize the duration and the severity of the flu, which is really important in those that are at higher risk for complications. The same is true of COVID. It may not keep you from getting COVID, but what it's going to do is give you that boost of immunity. Whether you've had COVID in the past or not, it's going to give you that fresh boost of immunity as we go into the primary respiratory season, where people are gathering at the holidays, people are now indoors, you don't have windows open, kids are back in school, and so getting that vaccine gives you that boost of immunity to really fight off if you do get COVID, that it will be a milder case. In fact, some people will say, I had COVID, I never had symptoms, right? Or I had COVID, it was just sort of like a basic cold, versus I had COVID and I ended up in the emergency department and had to be hospitalized.
One of the reasons I told you beforehand that it's so great to have you on this stream is because having a professional, having an expert, being able to talk about this is so important, like you said off the top there. And we know that there's also people who don't always have the facts when it comes to this. Are there any particular vaccine misinformation that you've been hearing from patients and you want to kind of address and get the right information out there?
Yeah, I think, one of the things, and it really goes back to the comment I just made. I think, I hear, well, I got the COVID vaccine or I got the flu vaccine and I still got COVID or I still got the flu. So why bother getting the vaccine? I think really people understanding it's not always about fully preventing you getting it. It really is about making that illness that you get much less severe, which is really critical in those that are at higher risk for severe complications. So understand, at least for those two vaccines, it's not about avoiding getting it. It's about protecting you so that you're not going to get as ill as you may have gotten otherwise. I think that's probably the one big misconception. And I know at the recent advisory committee for the CDC, that was one of the points the committee really felt like the American public doesn't maybe understand. And I think that is where having that conversation with your healthcare provider can be critical, to really talk with them about your specific situation, your specific concerns, and then make your personal decision about whether the vaccine is right for you, especially if you don't have other risk factors.
I have a feeling I know how you might answer this, but with all of the changes and the conversations that are going at the federal level when it comes to vaccinations and just in general in healthcare, what would you advise for an everyday citizen in terms of taking all of that in and making a decision for their health?
Yeah, I would say, first of all, use reputable data. There's a lot of what I call, there's a lot of things that we see on social media. There's, you really want to get it from the source. So I would say when it comes to vaccine, the two sources of truth that I would look to, one would be the CDC. They just updated their vaccine guidelines to include the updated recommendations for COVID. It was just posted earlier this week, so you can go onto cdc.gov, Google vaccines, you can pull down the whole vaccine schedule. So I'd say go to the data on the CDC. I'd say the second is the Virginia Department of Health. They publish some very common sense type guidelines as well as reference all of the CDC. So I'd say go to a reputable website to get the information. And then I think secondarily, armed with that information, if you still have concerns or questions, have that conversation with your trusted healthcare provider.
And anything else you want people to hear before you go? You got the open floor. There's something else you like, we did not hit on that, and people need to know this information. Anything else?
Yeah, I think one of the things is to understand, there is an optimal time to get vaccinated if you're talking respiratory season. COVID has become a little bit more of a year-round type event, but it still typically shows its worst in what we would consider to be the respiratory season, which is the fall into the winter. So when it comes, first of all, to influenza or flu vaccine, it's optimal to get those vaccines in September or October. You don't want to get them too early because you want them to cover you through the flu season, which typically ramps up in November or December. optimal to get it by the end of October, maybe early November. For COVID, it's a little more in flux, but I would say the same rules sort of apply. As people are getting ready to gather for holidays, especially if you're going to be in a situation where either you're high risk or there's somebody in your family that's high risk you're going to be around, you want to go ahead and get your vaccine before those gatherings start. And with any of these vaccines, they take about 2 weeks to start working. So I would say people need to start planning between now and maybe the middle of November to really think about getting their flu and COVID vaccine so they're protected for the upcoming holiday season.
Thank you so much for coming in and breaking all of this down. Again, it is so good to have you, Cindy, breaking down the information that matters when it comes to our health, because there are so many different things that people are hearing. And so to get it from an expert is very important for folks as they're trying to make decisions about their health.
Always happy to do it.